So now I'm going to first inspect the head for any skin infestations or any alopecia, which I don't see, dandruff, okay? Now I'm going to palpate the head. Tell me if you feel any tenderness.
No.
Okay, I also feel no bumps. And so now I'm going to begin with the ears. Okay, so I'm going to be checking to make sure if there's any drainage or discharge coming out, and I don't see any. Patient size is appropriate to patient's face, and tympanic membrane is pretty gray. And I'm going to be doing the whisper test, which is testing for cranial nerve 8. And so I'm going to whisper a word to you, just repeat it back to me, okay?
Yellow. Green.
Okay, and so now I'm going to ask the patient if you're able to ambulate by yourself, or do you need an assistive device?
No, good.
Okay, so can you stand up for me, please? Okay, so I'm going to ask you to close your eyes. I'm going to put my hands in front of you and just keep your hands there for 20 seconds. Okay, I saw no signs of swaying. So if you can please walk a little forward and then come right back. Okay, so now I'm going to be testing for the upper cerebellar and the lower cerebellar. So if you can please just go like this. Okay, now heel to shin. Okay, perfect. So if you can sit back down for me. Okay, so that was testing for also cranial nerve 8, the Romberg test. And so now I'm going to be doing the eyes. So I'm going to be first inspecting. I see that the sclera is white, the conjunctiva is pink. I see no signs of infection or redness. So I'm going to be checking for cranial nerve 3, which is trilla. Okay, pupils constrict and dilate, and pupils are equally round reactive to light accommodation. Follow the pen light. Okay, so now I'm going to be, that was cranial nerve 3, now I'm going to be checking for cranial nerve 4 and 6. So just follow the light for me, the tip. Okay, so now I'm going to be checking for the Snellen chart, which is cranial nerve 2. So I'm gonna place it in front of the patient. Do you wear any contacts or glasses?
No.
Okay. And so patient was able to repeat the words back to the letters back to me. Patient has 20/20 vision. Okay. So now I'm going to go to the nose. Okay. The nose is symmetrical to the patient's face. The septum is in the midline. I'm gonna check the patency. Breathe in for me. Okay, patency was good, and I see no discharge or drainage. And so now I'm going to be checking the olfactory nerve, which is cranial nerve 1. So close your eyes and smell this for me. What do you smell?
Alcohol.
Okay. So now I'm going to be checking for the mouth. So lips are pink and moist. Mucous membranes are pink. I see no signs of hairy tongue, swollen tongue, decaying teeth, gingivitis. So I'm going to be testing for cranial nerves 9, 10, and 12. So I'm going to be checking for gag reflex. And I'm going to be checking for if you're able to swallow. Can you swallow for me? And I'm going to be checking for tongue movement. Okay? And so now I'm going to be checking for cranial nerve 5, which is trigeminal. So can you smile for me? Okay, I see no signs of facial drooping and face is symmetrical. And I'm going to ask you to close your eyes. Did you feel that?
Yes.
Okay, that was checking for cranial nerve 7, which is facial sensation. And now I'm going to ask you to shrug your shoulders. Okay, that was checking for accessory nerve, cranial nerve 11. And now I'm going to begin with the neck. And so now I'm going to be first inspecting. I see no signs of, I see the trachea is in the midline. I see no signs of bruising or any swelling. And I don't see the thyroid gland, which is good. I'm going to palpate it. Okay, which is non-palpable, which is good. Now I'm going to palpate the lymph nodes, the 9 lymph nodes. Okay. Palpables are not tender to touch and they should move freely. And so now I'm going to be checking for the JVD, so if you can please look to the left. Okay, I see no signs of any JVD. If she did, that would mean right-sided heart failure. And so now I'm going to be checking for the carotid arteries. I'm going to auscultate them first to check for any bruits. Okay, and I'm going to ask the patient to sit up for me, please, and I'm going to compare with the apical pulse. Okay, and it was symmetrical, and now I'm going to palpate the carotid pulses, arteries. Okay, so now I'm going to check the patient's chest, and I see no lines. No placement of central lines, no bruising, no swelling. Patient's respiratory expansion is normal, so can you please lean forward for me? Okay. Breathe in for me. Okay. Patient's lungs expanded symmetrically. Auscultate your lung sounds. Breathe in for me, please, whenever you feel it. Okay, now I'm going to be checking the heart sound, starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral apical pulse. Okay, and so now I'm going to ask the patient to lean forward so I can do the posterior and ask her to breathe in whenever she feels it again. Okay, patient's lungs were clear, patient range of motion. So I'm gonna ask you, patient's range of motion and muscle strength. So can you please squeeze my hand? Okay, are you able to shake my hand? Okay, are you able to pull against me? Okay, and now I'm going to be checking your radial and brachial pulses. Okay. And so now I'm going to be doing the reflex with your, first starting with the tricep, now the bicep, and now the brachioradialis. Okay. Patient's reflexes were good. And now I'm going to begin auscultating, starting with the right lower quadrant. Okay, now I'm going to palpate, starting with the right lower quadrant. Tell me if you feel any tenderness or any pain. Okay, now I'm going to percuss. No pain? No. Okay. So now I'm going to be moving down to the lower extremities, and I'm going to begin with the range of motions with your feet, so if you can flex forward. Okay, now flex back. Okay, now flex against me. All right, so now I'm going to be checking the legs for edema. Okay, I see no signs of edema, no redness, and no swelling. And I'm going to be checking for the duralis pedis. The posterior duralis, the popliteal pulses, and the femoral pulses. And so now I'm going to be checking for the reflexes in the patellar So now I'm going to be checking for capillary refills. Okay. All right. Looks good. It's less than
of the wrist and the hand. And if you feel any pain or discomfort, just let me know, okay? The first thing that I want you to do is put your elbow on the table like this. And now flex your wrist down. Good. Okay, and now I want you to extend your wrist back for me, please. Thank you. You can relax. Now I want you to do on the table, put your palm flat down and turn your wrist towards your pinky. Good. Okay, you can relax. And now turn it towards your thumb. Okay, you can relax. All right, now I'm going to be testing the joints of the hand. I want you to make a flat fist with your thumb like that. Good, and I'll be testing these joints, okay? I'll be measuring them. Okay, now I'll be testing these joints right here. Okay, relax. All right, and finally I want you to make this kind of like bear claw. I'm going to be testing these disc joints. Okay, you can relax. Right now I'm going to have you do, I'll kind of show you an example first. I'll be putting this goniometer down and you're going to be curling your finger and coming down as far as you can on this distal palmar crease, okay? Turn your palm up. Start with the pinky. Good. Good. Okay. Good. Now we're going to be testing the thumb. Turn it. All right, now what I want you to do is turn your thumb out. All right, now turn your hand off to the side and stick your thumb out again. All right, now with your hand to the side like this, no, you can keep it straight, I'm sorry. Flex your thumb all the way down like this. Good, I'm measuring this straight here. Good, and now turn your thumb and bend it like this. Okay, you can relax. Now what I want you to do is touch your thumb to every single finger. Great. All right. Now what we're going to be doing is hand and muscle testing. So now that we finished measuring everything, what I want you to do is turn your palm facing up again. And I want you to flex your wrist and then turn your wrist and then turn your wrist towards your pinky. Good. You can feel it right there. All right, now I want you to hold it there and don't let me move you. Good. Now go back to the midline. Now I want you to flex your wrist and turn it towards your thumb. Good. Kind of move a little bit. Move your fingers, I'm sorry. Move your fingers in. Okay. Now I want you to hold it there and don't let me move you. Okay, you can relax. Now if you have your palm facing down, I want you to extend your wrist. Turn it towards the pinky. Good. All right, kind of move your pinky up and down. All right. I want you to hold it there and don't let me move you. Good. And now extend your wrist back again and turn it towards your thumb. All right. I want you to hold it there and don't let me move you. Good. Now what I want you to do is kind of bring your arm back. Bring this arm back, sorry. And then come forward. Okay, and extend your wrist back. All right, now I want you to hold it there and don't let me move you. Good. And you can relax. Now that we've done that, we're going to turn our wrist to the side and flex it. Good. Hold it there and don't let me move you. Good. Now I want you to hold your hands on the side like this. Yeah. Hold there and don't let me move you. All right. I'm going to do. All right. I'm going to do this one. Hold it there and don't let me move you. Good. All right. Now I want you to relax. Now extend your wrist back. Good. All right, hold it there and don't let me move you. Good. All right, now I want you to hold it there and don't let me move you. Good. And hold it there and don't let me move you. Good. Okay,
Close your right eye, and I'll close my left eye. And if you can look and see how many finger I have here.
2
Okay.
and then 1.
Okay. And I close the other eye. I'll close my right eye. And how many fingers can you see?
4.
Okay. And now just if you can follow the light without you moving your head. Perfect. Up and down. Perfect. I'm just gonna look at your eye over here. Perfect. Fantastic. Okay. And I'm gonna check over here. If you can just look straight for me. Good. Just gonna come to this side. Really good. I'm just gonna look up your nose. Good. Just gonna check your sinus. Any pressure here? Any
No.
pain?
No.
Perfect. Can you open your mouth for me and say ah?
Ah.
Perfect. Okay, I'm just gonna come over here and I'm gonna whisper something
Okay.
and just tell me what it is.
Okay. Baseball. Green.
Perfect. Alright, I'm just gonna take a look at your ears. I'm gonna check on the outside first. Any pain?
Mm-mm.
good. Looks good. Perfect. I'm just gonna check with this. Just let me know where do you feel that.
Right in the middle. I can hear it equally.
Okay. How about here? Tell me when it's stop.
Stop.
About right now.
Stop.
Okay. Air conduction is higher than bone conduction. Let's try this side.
Stop.
Okay.
Stop.
Perfect. Alright, so I'm gonna check your back
Okay.
for now. I'm gonna check for symmetry. Good. Can you take a deep breath for me? Perfect. One more. Perfect. Can you say 99?
99. 99. 99. 99.
Good. Okay, so I'm just gonna percuss over here. Okay, let me know if there is any pain or tenderness.
Okay. No pain.
Good. So I'm just gonna listen real quick. Take a deep breath for me. One more. 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 Perfect. I'm gonna listen to your heart. Aortic, pulmonic, herbs, tricuspid, and mitral. One more time. Aortic, pulmonic, herbs, tricuspid, and mitral. Before you lay down, can you move your neck for me, like side to side, up and down? Any pain, any tenderness?
Mm-mm.
Perfect. You think you can lay down for me?
Mm-hmm.
I'm gonna listen to your heart one more time. I'm just gonna listen to your carotid. Good. I'm just gonna take a look at your belly. Good. I'm just gonna listen. Good. Sorry, my hands are cold, but I'm just gonna try to palpate here. Any pain?
Mm-mm.
Over here, here,
Mm-mm.
here. How about if I go deeper?
Mm-mm.
Right here, right here. Good. Alrighty. You can sit for me. I'm gonna do one test. I'm gonna give you some water. If you can take a sip and just keep it in your mouth. Already? I'm gonna come over here. And I'm just gonna palpate your trachea. Can you swallow? Perfect. Alright, so I'm gonna do a couple tests. Can you lift your knee for me? Don't let me push. Perfect. The other one. Good. Can you put your arms up higher? Don't let me pull them. Good. I'm gonna push. Perfect. Can you put them straight? Don't let me push. Perfect. Can you do your fingers like this? Don't let me close them. Good. Can you do real quick? Up and down, up and down. Perfect. So I'm gonna check real quick pulses. Okay. Up the tail. I'm gonna check the penis. Perfect. So I'm gonna do this. If you can put your hand like this. Do you feel this?
Mm-hmm.
Let me know when to stop.
Stop.
Okay. This one.
Stop.
Okay. I'm gonna do it on your feet over here. If you can just on your toes.
Stop.
Okay.
Stop.
Perfect. So I'm gonna do this test too. If you can just put your hands over it. Perfect. I'm gonna do the other one. Okay. I'm gonna do your knees. Okay. Oh. Okay, so I'm gonna do your ankle over here. Kelly. Okay. Perfect. I think one more thing, if you can stand for me and put your hands out, close your eyes. Perfect. Okay. Can you walk 3 feet and come back? Perfect. Can you walk on your toes and come back on your heels? Good. Can we do ankle to chin or chin to knee? The other side. Perfect. Well, that's include the whole assessment. If you have any question for me, I can answer it.
I don't think that I do. Thank you.
All right. Perfect. Thank you.
Yeah.
We'll see you next annual checkup.
Yeah, thank you.
Thank you.